I'm joined by Carol Weissert, Professor of Political Science at Florida State University and 2015 Fulbright Distinguished Chair in American Political Science. Thanks so much for joining us this morning, Carol. You came to Australia on a Fulbright to research Australia's federalist system, specifically how our federal and state governments interact on healthcare policy and how this is affected by changes in leadership and political polarisation. Firstly, can you talk a little bit about what you found?
Sure. I was particularly interested in Australia about your Council on Australian Governments, which has recently been disbanded, much to my dismay, because really it's a formal way that the national government and the state governments in Australia work on issues. And I was really fascinated because you have this highest level with the Prime Minister and the premiers, and then you have a level with their executive assistants, and then you have a level with the ministries of health, and then you finally have a level with the staffing people who staff the federal level in health and in the state level. And it's a very formal procedure, but it's formal in the sense that they sit at a table together and they talk about these issues. We have nothing like that in the United States. The closest thing we have associations of governors and associations of state legislators, and the president meets with the governors once a year, but it's not the same sort of an interactive kind of thing where here we have these problems and we're going to solve them. And I was really envious of Australia for having COAG, and now it no longer has it. Well, one of the things that my work compares to Australia and the U.S. is the U.S. has a lot more informal kinds of relationship between the federal government and the state government. And I think that's what Australia will end up doing more as well, where you don't have a formal setting, but you have individual states that will work with the president, or you have individual states who work together on certain kinds of issues. And so it's, I think Australia will be moving a little bit more toward the U.S. model. One of the things that, of course, was a really big difference, not only in the size of the country, but that we have 50 states and 5 territories, and you have 6 states and 2 territories. So it's a lot easier to get everybody around the table in a formal kind of setting. But the point of the study really was to look at how the federal government and the state government cooperate on issues of the day. And that leads us in, of course, to the COVID-19 situation, where, at least in the US point of view, the federalism point of view, the federal government really sort of did not do its part in the relationship. And we saw that the states really did pick up a lot of the slack here.
What are your comments on how these interactions and cooperation, or lack thereof, are playing out both in Australia and the United States?
Yeah, well, in Australia and in the U.S., one of the real benefits of federalism is that you have sovereign governance. So you have the states in Australia and the states in the U.S., and they have control over certain kinds of issues. And the federal government can get mad and they can complain and they can hold press conferences, but they really can't force Daniel Andrews, or they can't force Ron DeSantis to do something they don't want to do. And that's, of course, one of the really big advantages in federalism. The other thing that we've had more in the U.S., and I don't have as good a sense of it in Australia, is that the federal government in the past in the U.S. in times of emergencies has really served to provide assistance in funding. They've assisted local governments and state governments in terms of manpower if they needed it, in terms of equipment, in terms of just helping to buy things, if you will, because it's easier to buy it for the whole country than it is individual states. What we've seen in the U.S. is really in the early days of COVID-19, when it was clear that the federal government was not going to play that role that they played in the past, the states really started competing with each other. So we had the states that were trying to buy, for example, protective equipment for their hospital staff, and you had Maryland competing with Idaho, competing with Florida, which really shouldn't have happened, but it did. And so that was really kind of the downside of federalism, is you had all these 50 states competing with each other. When the initial first wave sort of passed and the states had time to sort of get their bearings, they started to work together, which is what you would think would happen in a federal system. And I know they do that in Australia as well, because Daniel Andrews has talked about how he talks to the other premiers about these issues. And that's what we've had in the United States. So you've had the states really talking to each other, and they have formed compacts where these are formal compacts where they've agreed to work together on everything from closing borders to the new one is getting tests for COVID-19. So what we've seen is that where the federal government is not really providing that coordination, the states are doing it themselves. So the case really represents both the worst of federalism, the states competing against each other, and also the best of federalism where they actually can work together as well.
Absolutely. So we've also seen some rather politically charged disagreements between the federal government and state governments over law enforcement issues in the context of the Black Lives Matter protests. What are your takeaways from how this is currently playing out?
Yeah, it is similar in some ways, and it's really different. At least in the U.S., it's different, and it's different because it's become much more political. Now you might think, how could COVID-19 not be political? But what we've seen from COVID-19 is that the governors have really acted in a bipartisan way. And the president was a little more partisan, but the governors kind of went along their merry way and just sort of ignored the president at some point and did what they wanted. In the Black Lives Matter and the protests, we've seen since we have an election coming up in 2 months, that it's become much more of a political issue, and the president is really sort of cast it as a law and order kind of issue. I think the low point of federalism in this issue has been when the president sent federal officials, federal officers really, to Portland, Oregon, a city that has had a lot of protests, without being invited by either the mayor or the governor. And that's really, and I've been following federalism for a really long time, and that was really unprecedented in my experience, that because usually the president will request, or typically the governor will request assistance from the federal government, and this was not the case. Fortunately, they didn't stay long, and then things got back to normal. But the other thing that's interesting in a federalism point of view is that it's not as much governors as it is mayors. So what we have is the mayors of these cities that are in charge of the police. Now the governors call forth the National Guard, so the governors and the mayors are working together. But again, President Trump has used that as an opportunity to talk about Democratic mayors and really make it much more partisan. So from my point of view, it's similar. You have these federal-state conflicts, and then you have the local government as well. But it's really different because it really has played into pre-electoral rhetoric, if you will, and that's really too bad. I think that's too bad on sort of everybody's point of view, but it is what it is. But again, you have these states who are trying to deal with their own problems, and their local governments trying to deal with it, and then the federal government sometimes, stepping in when they shouldn't, maybe.
As I mentioned at the start of this interview, you're an expert in healthcare policy. And polling in 2019, right up to the start of this year, suggested that healthcare was going to be the most important issue for US voters, regardless of party allegiance. Since then, we've seen the economy. Polling has suggested that the economy has overtaken healthcare as the most important priority for US voters. And this, despite a rapidly intensifying public health crisis. So what does this polling tell you?
Well, I guess three things. One is, it doesn't surprise me. The economy is always a big issue in U.S. presidential elections. So I think we could have told that as you get closer to the election, the economy is going to become more important. In fact, a lot of models, political science models, predicting who's going to win the economy is one of just a very small number of variables. And because people, they're either happy or they're unhappy. And the economy, they either have the job or they don't. So it's really important. The second thing is that COVID-19 and the economy are so intertwined, it's really difficult to separate them out. Now, I know that people say, oh, I'm really worried about the economy, but the economy is really a problem because of the COVID-19. And I think it's really hard to sort of disengage that. And the third thing is that this is really an area where you have to go down the next level and look at partisanship. I think the numbers, you were correct, the numbers that I saw, the Pew numbers lately, where 79% of people thought that the economy was an important problem, and only 68% of health. But health was up there. But if you disaggregate that down to the Republicans, for example, you find that Republicans say 88% of Republicans say that the economy is the #1 issue. And their second issue is violent crime. If you look at Democrats, their top issue is, in fact, health, 84%. Coronavirus, which is certainly is a separate issue, but it was related, is 82. And then racial inequality is the third issue. So to some extent, that number is a little bit misleading, because it really does divide down by party in a real stark way. Now, what happens is the independents, I don't have the independent numbers, but they're somewhere in the middle. They are not quite as dealt with the economy, and not quite as in the healthcare area. I think I'm still a little bit surprised that the economy is so high, given the coronavirus situation. But I think I think it is just the fact that people relate to, do they have a job? How is the economy working? And certainly in the election, the rhetoric around the election has really focused on the economy, and Trump recognizes that that's important for the Republicans, and he's been really talking a lot about how when this is over, the economy is going to go back and it's going to be great. So it's a little disappointing, yes. We had what we call midterm elections, which are elections they're non-presidential elections, where we elect most of our governors and we elect senators in those elections as well. And the 2018 midterm health really was important. But again, those were sort of non-presidential elections. So in presidential elections, the economy almost always is the key topic, even in a time of a pandemic.
So, I mean, as you know, Australia and the US have very different healthcare systems. From a policy perspective, how have you seen America's healthcare system hold up during this very difficult time?
Oh, that's a good question. Well, yeah, you've got a much better system, and one of the reasons that yours is so much better is that we have a very large portion of our population, 10 to 15%, that are uninsured, and so they have to go to hospitals. And so in the coronavirus, what we saw was the hospitals were in a lot of areas, not in all areas, but a lot of areas where really had a lot of COVID-19 patients. And so people that might have ordinarily gone to the hospitals for care didn't get that care. So what we don't know is the long-term implications of that. There are a lot of people who worry that because the people didn't get care during that period of time, they were afraid to go in or whatever. There may be a spike in 6 months, a year or so, of those people who will be very sick because they didn't get the care that they needed before. The public health system, I think, well, I don't know, it worked reasonably well in some sense. There wasn't as much testing as a lot of people wanted. But there's been some controversy about federal government's kind of educational process. But again, I think the states really stepped up and did a lot of education for their public about the COVID-19. And one of the reasons the governors are so popular is that a lot of them are on TV every day. Governor Cuomo of New York is kind of the case in point, but he wasn't the only one. He had a show every day at noon, and he would talk about what had happened and, what people should do and what people shouldn't do. So again, this was a case where, in terms of public health, the federal government didn't do the education that they might have done in the past, because there was a lot of resistance to recognizing there was a problem. Whereas the states really did that. And they said, wear a mask. They said social distance. This is why you're doing it. And they used bar charts and graphs. And then a lot of that went down to the local level, and the local level in the United States has a lot of public health. So I think that the good news is, again, the states picked up some of the problems there with the public health side.